Welcome to the 2026 Plan Year New Hire Benefit session. Our goal today is to give you information and tools that you need to make the best benefit choices for yourself and your family. So let's get started. On our agenda today, we'll be discussing benefits available to all associates, core benefits, supplemental benefits, dental and vision, and next steps in how to enroll. First, we'll discuss benefits available to all associates. First up is SupportLink. SupportLink is a free and confidential employee assistance program designed to assist you with a wide range of both personal and professional concerns with a focus on mental health. Everyone that is employed by Benchmark is eligible to use SupportLink along with your spouses, your dependents, or any household members you might have. Those emotional well-being and work-life balance resources can look like in-the-moment support by phone or live chat, financial expertise, legal consultation, or even short-term counseling sessions with up to 5 no-cost counseling sessions per year per concern. You can also get convenience resources such as referrals for child or elder care, housing needs, education, and much more. Next up, we have FIGO Pet Insurance. This is a United Healthcare company designed to keep your pet protected from head to tail. With this plan, you pay FIGO directly and get great benefits, including the freedom to see any veterinarian, 24/7 access to a live vet for virtual visits, a simple claims process, direct deposit reimbursement, and even a digital inbox for your pet's records and plan documents. Here's how it'll work. You'll start by choosing one of the 3 power-ups that fits your budget and pet's needs. From there, you can add power-ups like dental or wellness coverage. And when you enroll through Pyramid, you'll actually receive a 10% discount for your first pet and an additional 5% when you add a second pet. Once you're enrolled, you'll have access to the Pet Cloud, an app that helps make your pet parenting easier with tips, reminders, search tools, all in one place. If you're interested in a quote, please scan that QR code or visit Benefit Hub for more information. And speaking of Benefit Hub, this is going to be your resource to enjoy discounts, rewards, and perks on thousands of different brands you love in a variety of different categories, such as travel, auto, apparel, restaurants, even your movie tickets or your tickets to an amusement park. If you're interested in signing up, you can go to pyramidglobal.benefithub.com or scan that QR code on your screen. Discuss another financial resource, Smart Dollar. Smart Dollar is a free financial well-being tool created by Dave Ramsey that allows you to ditch your money stress, learn to spend less, save more, and get rid of debt for good with tools such as the Debt Snowball tool, financial coaching, either one-on-one or in a group setting, a retirement planner, even the ability to do your taxes for free with Ramsey Smart Tax, and finally, access to that Every Dollar budgeting app by Dave Ramsey, totally for free. If you're interested in signing up, you can do so on smartdollar.com/enroll/pyramidglobal or scan that QR code. Next, we'll cover your 401k retirement savings plan. Pyramid Global partners with Fidelity to give you a smart, simple way to build financial security for the future. If you're 18 years or older who have completed at least 3 years of service, you are eligible to enroll and can contribute anywhere from 1 to 90% of your salary, either pre-tax or Roth after-tax contributions, up to that IRS limit. Now here's the best part, the company match. Pyramid Global will match 100% of the first 3% you contribute, plus 50% of the next 2. I like to say that is a really fancy way of saying when you contribute 5% of your income, we will contribute 4% match, which is essentially free money added to your retirement savings. And you're immediately vested, which means every dollar you contribute to your 401k, as well as what Pyramid contributes to your 401k, is yours from day one. Don't wait to start saving. Even small contribution today can grow into significant savings over time. Enrolling now puts you on the path to a more confident, secure retirement. Benefit available to all associates is our Better Together platform. This is a comprehensive well-being tool designed to support you with all 4 foundational pillars of wellness: physical, emotional, financial, and social. Here you'll be able to find each benefit you are eligible for and information on how it can impact you. How to find this website, you will go to Workday, hit that menu button, scroll all the way down to external links, and then click Better Together. Now we'll talk about our core benefits. On the same page regarding benefit terminology, starting with deductible. Deductible is the amount that you will pay before the plan begins to pay. So for example, if you were to break your ankle day one of your coverage, so January 1st of 2026, you break that ankle. When you go to your doctor and get your x-rays and get your treatment, you may pay the total amount of that care out of pocket unless you have met your deductible. Once you have met your deductible, meaning you have paid that amount towards your medical bills, you will pay your coinsurance, which is a percentage of the charge that you will pay, again, typically after that deductible has been met. Next is out-of-pocket maximum. This is kind of what it sounds like. This is the max amount that you will pay for covered services within a plan year. However, if you do go out of network or receive any non-covered treatment, you may still pay additional amounts. Next, we have copay. Copay is the flat dollar amount that you pay at the time of medical service. I like to say typically your copay just gets your foot in the door to be able to have a conversation with that doctor. So on your traditional health insurance models, a copay will allow you to have that conversation with that doctor, let them know what's going on. However, the minute your doctor says we need to run additional scans, additional blood work, additional treatment, what have you, that may result in an additional cost. Terms we'll talk about are in-network and out-of-network. So a network is a group of providers, doctors, hospitals, and pharmacies who have contracted with your insurance company to provide you service at a discounted rate. However, if your doctor is out of network, this is a provider who is not contracted with your health insurance company. So this may result in higher costs when going to this doctor. We'll take a look at our 2026 overview. We have 4 medical plan options, a Surest plan, an HPI Silver plan, and 2 United Healthcare plans. All 4 of those medical plans will come with a prescription plan through Optum Insurance. We offer 2 Delta Dental plans and a United Healthcare Vision plan. Any of your eligible dependents can be added to any of these plans, such as your spouse, your domestic partner, or any children you may have up to the age of 26. Adding dependents onto your plan, you will need to verify that they are who you say they are, and they're eligible to be on your health plan. So our dependent verification company, DSI, will reach out to you via paper mail to let you know how to verify that dependent. You will be asked to submit documents either online, via email, fax, or by mailing non-original copies to DSI directly. If you are mailing your copies in, please make sure you are not sending them any original documents, as they will not send these back to you. And if you're scanning or uploading your documents, please make sure all pictures of your documents are legible before you upload or email them. Let's take a look at our medical plan options. We have 4 medical insurance plans for you to choose from. Our Surest plan, our HPI Silver, or our UHC Value plan will all be PPO or Preferred Provider Organization plans. Our final plan, the UHC Saver, is a HDHP or a high deductible health plan that includes access to a tax-advantaged health savings account from Fidelity. Now let's take a look at each of these plans and how they are a little bit different from one another. With your Surest plan, you get what you expect from a health plan, only with price visibility. So you're able to check and compare costs and options, and even better, lower costs are actually indicative of higher value care. So Surest has looked through their network of doctors and determined those doctors who have had that highest value care and put the lowest price tag on those providers to help encourage you to go to the best providers available to you. Also on this plan, you have a $0 deductible, so you don't pay twice for your coverage and you get the full benefit of your insurance on your very first visit. You have clear and upfront costs, so you'll know exactly what you owe before you make an appointment. And you have coverage in all 50 states through the National UHC Choice Plus network. Services are assigned a price tag or a copay. For preventative care, the copay is typically $0. For office visits and many procedures, from having an MRI to having a baby, you'll see one price. By grouping these services together, combining the labs and x-rays that go along with a medical procedure or test into one price, it makes it easier for you to know what you'll pay in advance. So for example, you will search Surest app or surest.com for what you need. You'll see that smart price for treatment options and providers in your area and see what those providers will charge you for that treatment. Smart price you see will include everything the doctor does during that visit. So for example, we'll take a look at everywhere in the DFW area that you can have a baby and at exactly what cost. This cost is going to include everything that typically goes into maternity delivery care, such as your room and board, your anesthesia, and your delivery, whether it's vaginal or C-section. Now, of course, if anything happens with mom or baby that does require additional care, there will of course be an additional cost associated with that treatment. However, it will always be in the form of a copay, so never a co-insurance or some percentage of some unknown bill. Next, we'll talk about United Healthcare and Lantern. Our United Healthcare plans are your standard insurance model. So when I say you need to meet your deductible and your copays only get your foot in the door, these are the plans that I'm typically referring to. Neither of these plans will require referrals. However, you might be asked to connect with Lantern for some procedures. Lantern will be your guide to excellent surgical care. If you never ever need a planned non-emergency surgery, Lantern connects you with top-rated board-certified surgeons while also helping you to save money. Their network includes thousands of procedures such as joint replacement, spinal fusion, bariatric surgery, and more. If you enroll in the Value or Saver plan, you will be required to use Lantern for certain procedures, specifically joint replacement, spinal fusion, and bariatric surgeries. For most members, Lantern is provided at no cost out of pocket. However, if you are on that Saver plan, you will need to meet the IRS minimum deductible before the benefit applies. When a surgery is needed, you'll first contact your dedicated care advocate, a real person who understands both your needs and your family's needs. From there, Lantern takes care of the rest, scheduling, paperwork, and ongoing support from start to finish, so you can stay focused on your health and recovery. Look at HPI and your coverage with the Silver Plan. HPI, or Health Plans Incorporated, is a third-party company that partners with Pyramid Global to administer your medical benefits. So their primary role is to make sure your medical claims are processed quickly and correctly. They also double-check your bills to protect you so you don't get charged for services you didn't receive and you don't overpay for the ones you did. For the most part, your coverage will look and feel a lot like your previous plans, covering doctor's visits and other services like labs. The main difference is that you'll use a network called the PHCS network. That simply means you will want to double check if your current doctors are in network. Now, you do have the option to see a provider out of network, but please keep in mind there's a chance that you could be balance billed if that provider does not agree with the amount your plan determines as fair and reasonable for the services provided. For inpatient and outpatient services, HPI bases pricing off of the Medicare rates and actual service costs. Because of this, a pre-certification is needed for planned procedures. This helps protect you and your family while also keeping costs fair. However, when it comes to emergency care, you will always have open access to hospitals with no restriction. In your healthcare journey with the Silver Plan, you will have access to Pathways Concierge Service. This team connects you with an advisor who can answer questions about your benefits like copay, deductible, and balance billing, and help you find providers or facilities in your area. They'll also make sure any pre-certifications for inpatient or outpatient planned procedures are approved before your care begins. Your physician is required to pre-certify treatment at least 7 days before the procedure, which allows the facility to be notified of the plan's reimbursement amounts in advance. If for some reason a facility doesn't agree with that amount, a Pathways Concierge member will review your options and may recommend a more cost-effective alternative. In addition, they'll help prepare and educate you for a hospital stay or procedure and assist with resolving claims, billing issues, grievances, or appeals. You can connect with Pathways Concierge using their number on the screen. Advisors are available Monday through Friday, 8 a.m. to 8 p.m. Eastern, and if you leave them a message after office hours, they will call you back within the next business day. Let's look at how billing is a little different with each of these plans. Pricing will vary depending on your specific treatment and your provider, but let's take a look at some example figures for knee replacement. Again, these are only example figures, so these numbers may not reflect what you experience if you are looking to get a knee replacement in 2026. Starting with Surest, their starting price, or what the hospital wants to bill, just your average Joe Blow who is getting a knee replacement, is $75,000. Your price plan, because you are with Surest and the hospital is contracted with Surest, is going to be $45,000. However, Surest has determined that your copay will be either $400 up to $2,400, depending on your provider. Let's guess that your provider is somewhere in the middle of that range and your bill is $1,200. Next, we'll take a look at United Healthcare. That starting price and that plan price are both the same. However, United Healthcare will bill you 20% of that bill as long as you've met your deductible. That means your bill will be $9,000 at the end of the day. And then finally, we'll take a look at HPI. Their starting price is going to look a little bit different because they are basing their prices off of the Medicare rates. They will call and negotiate with that hospital to get as close to that Medicare rate as possible, landing on $22,500. Now again, you'll pay your co-insurance of 20% as long as you've met your deductible, and your bill will be $4,500. So because HPI was able to negotiate and advocate for your bill to be lower, you are experiencing a lower co-insurance as a result. Now let's take a high-level look at all four of those medical plans side by side. First, we have the Surest plan. This plan is unique because it's clear, simple, and predictable. You'll always see your costs up front, so you can compare prices and options before receiving care. There's no deductible and no co-insurance, making it easy for you to understand what you'll pay. Plus, the plan uses the National UHC Choice Plus network, giving you access to quality doctors across the U.S. The out-of-pocket maximum is $6,500 for individuals or $13,000 for a family. Office visits range from about $10 to $110. Urgent care is a $110 copay, and emergency room visits are $1,000. Outpatient or inpatient procedures can range from $80 to $5,500. Now let's move on to the Silver plan with HPI. The deductible for this plan is $1,500 for individuals and $4,500 for families, with an out-of-pocket maximum of $5,000 for an individual and $10,000 for family. Once you meet your deductible, your plan pays 90% and you cover 10%. Primary care visits are just $10, while specialist or urgent care visits are $50. For emergency room, outpatient, or inpatient care, you will first meet your deductible before your co-insurances apply. Moving on to our United Healthcare plans, compared to Surest, these are our more traditional in structure. With the UHC Value Plan, you can see any provider in the UHC core network with an out-of-network coverage available at a higher cost. The deductible is going to be $4,000 for individuals and $8,000 for families, with an out-of-pocket max of $8,000 for individuals and $16,000 for family. Co-insurance is going to be 20%, so the plan will cover 80% of your bills after your deductible has been met. Copays are $30 for your PCP or primary care visits and $100 for specialist visits or urgent care. Emergency services do fall under the deductible and co-insurance. For the UHC Saver plan, this is our high deductible health plan. You can see providers in the national network or out of network, though out of network may cost you a little more. With this plan, you must meet your deductible before the plan begins cost sharing, including prescriptions. But one advantage is that you can open a health savings account, which lets you set aside pre-tax dollars to pay for eligible expenses. The deductible on this plan is $3,500 for individuals and $7,000 for family, with an out-of-pocket maximum of $7,500 for individuals and $14,000 for a family. Office visits are deductible only, and coinsurance after that deductible is 30% for urgent care, ER, and hospital procedures. No matter which plan you choose, your pharmacy coverage is provided through Optum. A 30-day supply is going to be $10 for generic, $45 for preferred brands, and $65 for non-preferred brands. With a 90-day mail order supply, you save, paying for the cost of 2 months instead of 3. They choose these plans. Starting with Surest. So this plan might be for you if you like to know your exact cost responsibility prior to treatment, you want no deductible, you want to pay less for those blood works and scans that might go into your healthcare visits, you don't mind a higher weekly premium. And next, for HPI Silver, this plan may be for you if you want to know your general cost responsibility prior to treatment, you want to pay less for your procedures and your treatments, you want a low deductible, and you don't mind needing that pre-authorization for certain treatments. Now looking at the United Healthcare plans, these plans may be for you if you're looking for a more traditional health insurance model. If you use services like Talkspace or Calm Health sponsored by United Healthcare, and if you don't mind the higher deductible with that Saver plan, including pharmacy. Now the Saver plan may be for you is if you want access to that HSA or if you want to pay less per paycheck per week. Earlier, if you enroll in the Saver plan, you will also be eligible to contribute to a health savings account or HSA. An HSA allows you to set money aside from your paycheck to help cover medical expenses like your deductible, copays, or dental and vision costs. If you don't use the funds right away, the money stays in your account and can grow over time. This account is managed by Fidelity, so you can access your funds through a debit card, reimbursement, or paying your provider directly. Once you reach a minimum balance, you can even choose to invest the funds. This HSA is employee-owned, which means the money is yours to keep, so balances will roll over year to year, they never expire, and you can even use them into retirement. Plus, contributions, investments earned, and qualified withdrawal are all tax-free. If you choose the Saver plan, Fidelity will automatically set you up with an HSA. However, it is your choice whether or not you contribute. But if you do, keep an eye on your email. Fidelity may need a few additional details before completing your account setup. If you are interested in that HSA but were planning to enroll in a different medical plan such as Surest, HPI Silver, or the UHC Value plan, there is another option for you that is similar to the HSA with a few key differences. That's the Flexible Spending Account, or FSA. With the Healthcare FSA, you can contribute pre-tax dollars up to the IRS limit to use for medical, dental, or vision expenses. And with the Dependent Care FSA, you can contribute money per year to use for child care or elder care expenses. For both accounts, you can pay with your FSA card or submit claims directly. These accounts can also cover eligible dependents even if they aren't on your medical plan. And here's where the differences kick in. Any unused amounts are forfeited at the end of each year, and you must decide weekly contributions at enrollment and cannot change or stop them until open enrollment of the next year. Since the money in this account is forfeited at the end of each year, it is highly suggested that you have a plan for this money. For example, this account is great for individuals with regular expenses such as pharmacy expenses or regular treatment, such as allergy shots. So for example, if you had an allergy shot every single month that cost you $100 per month, you could put in $25 a week into this account to know that you are saving a little bit of money with your tax-advantaged account. You are always able to pay for your allergy shots each month, and you know that you are able to use all of the money in this account without fear that it will expire at the end of the year. All of our medical plans are paired with a prescription drug coverage through Optum Rx. To help manage pharmacy costs, our plan has specific requirements for maintenance medications through the CVS 90 Saver Plus program. Maintenance medications must be filled in a 90-day supply either at a CVS pharmacy or through Optum Rx home delivery. You also get 2 30-day courtesy fills before you're required to make that switch. After that, if you're not filling through a CVS or Optum Rx, you will be responsible for the full cost of medication. So please be sure that if you are being charged for the full cost of medication, you check to make sure that if this is a maintenance medication and if you should be filling it in a 90-day supply. By switching to the 90-day supply program, you'll save both time and money since you'll pay a lower copay and you'll only need a refill every 3 months. If you'd like to see if your medication is covered, find a network pharmacy, or estimate a drug cost, please scan that QR code. If you are on a medication that is not covered or has low coverage, or you just need help spending less on prescriptions, we also offer RX Savings Solutions. Once you create an account with RX Savings Solutions, they will be able to review the medication you have been prescribed, notify you of any savings opportunities, and help you make the switch to a more affordable option if you choose. Now we'll discuss our dental and vision options. Your dental benefits are provided through Delta Dental, and you do have 2 plan options to choose from. The first option is a Delta Dental Plus Premier Plan, or DPPO. This plan works like a traditional dental plan and gives you the freedom to choose your own dentist, whether they're in-network or out-of-network. With this plan, there is a small deductible of $50 for an individual or $150 for a family, and then you'll pay a coinsurance depending on the type of service you receive. Preventative care like checkups, cleanings, etc. are fully covered. Routine services such as fillings or extractions are covered at 80%, while more advanced services like root canals are covered at 50%. This plan also has an annual benefit of $1,500 per member, which is the most the plan will pay each year. For orthodontia, coverage is available for both children and adults. The plan pays 50% of the cost with a lifetime maximum of $2,000. The second option is the Delta Care Plan, or DHMO. This plan works more like a medical HMO, so you will need to select an in-network dentist, and if you do go out of network, you will be responsible for the full cost of care. Instead of paying a deductible and coinsurance, you'll pay set copays for each procedure. For example, fillings might range from no cost up to $115, and a crown could cost between $390 and $460. Preventative care like cleaning and exams are always covered, and orthodontia is covered in this plan for both children and adults. The cost is a flat copay of $2,525 for adults and $2,325 for children up to the age of 19. Now, let's move on to vision coverage. Your vision benefits are provided through United Healthcare, giving you and your family access to quality eye care at an affordable cost, including those all-important routine eye exams. The great news is that you can see any provider you choose. However, you will save the most and pay less out of pocket when you use an in-network provider. The plan includes a $10 copay for exams, a $20 copay for materials like frames, lenses, or medically necessary contacts. Eye exams and lenses are also fully covered, and you'll receive a $150 allowance that you can use towards retail frames and another $150 allowance to use towards contact lenses. Contact lens fittings and evaluations are also covered at a $25 copay, and medically necessary lenses are going to be fully covered. We can discuss a few of our voluntary benefits. Our supplemental health plans through Voya give you and your family extra protection when life throws the unexpected your way, like an accident, illness, or hospital stay. The best part, these plans pay their cash benefit directly to you to help with your expenses. You do not need to be enrolled in any of our medical plans in order to participate, and you can choose to enroll in 1, 2, or all 3 of these plans if you'd like. Plus, your coverage includes a wellness benefit, so each year you will get a cash payout for completing a covered screening, such as a mammogram, colonoscopy, or even a routine dental or vision exam. This applies even if the screening costs you nothing out of pocket. Do keep in mind that you will only receive 1 benefit payment per calendar year, no matter how many screenings you complete. And here's a bonus. Your spouse and each covered child can also add an extra $50 wellness benefit when they complete a covered screening, as long as they're enrolled in the plans as well. Next up is legal insurance. Our MetLife legal plan offers protection at every step with legal coverage to help with life's planned and unplanned events. Through the legal plan, you will have access to a wide network of attorneys available to offer consultation face-to-face, by phone, or virtually. So if you are someone who's planning on getting married, buying or selling property, starting a family, caring for aging parents, sending kids off to college, or you just have a chronic speeder in your family and you are expecting those speeding tickets or those parking tickets to be on their way, this plan may be a good option for you. Even better, our MetLife experts estimate that the entire year's worth of premiums for this MetLife plan equals just 1 hour of an attorney's time. So even if you use this plan just once to create your powers of attorney and your will, this plan will have been financially worth it for you. Next, we have our identity theft protection plan. The FBI receives over 2,000 fraud complaints daily, with victim losses reported to be over $10.3 billion last year. To keep you and your family safe from this, we're offering the MetLife Aura Identity and Fraud Protection Plan to help safeguard things that matter most to you, such as your identity, your assets, your reputation, and your money. This starts with identity theft protection that'll guard your social security number, online accounts, and more to guard against data brokers who are trying to sell your information online. You'll also get financial fraud protection to stay one step ahead of those threats with credit tracking, bank account tracking, and monitoring of your personal finances to keep those assets safe. You also get digital security to help you connect online with your US-based VPN and a password protection to help protect your passwords, your devices, and your Wi-Fi connection from hackers. This plan can be purchased for individual coverage, or you can utilize it for family coverage where you can add up to 10 adults and unlimited minors on your plan. Next, we'll discuss life and disability. Life insurance and accidental death and dismemberment insurance, often called AD&D, are provided through Securian Financial. All benefit-eligible employees will receive 1 times your annual earning for both basic life and AD&D at no cost to you. However, if this is not enough coverage for you and your family, you can also add voluntary life and AD&D coverage for up to 7 times your annual salary for the employee, up to $100,000 maximum for your spouse, and up to $20,000 maximum for your child. Now, in order to have coverage on either your spouse or your children, you must first have voluntary coverage on yourself. Now, with this plan, you do have to add a beneficiary, so please be sure to add a beneficiary to your basic life and basic accidental death and dismemberment plan, even if you are not interested in the voluntary coverage. Next, let's talk about disability insurance provided through Unum. This is the only benefit that I do recommend to everyone. This is because life can be unpredictable. Any one of us can get into a car accident or slip and break our ankle and be forced out of work for a period of time. If you're unable to work due to a covered injury, illness, or even childbirth, short-term disability will help protect your income. When you're focused on getting better, the last thing you want to worry about is your finances. And that's why this benefit is going to pay ongoing payments directly to you so that you can use them for medical costs, household bills, or your everyday expenses. Short-term disability gives you the peace of mind knowing your income is protected when you need it most. This plan will pay 60% of your weekly salary for up to $1,200 per week for 26 weeks of your disability after a 7-day waiting period. In addition to short-term disability, we offer long-term disability coverage as well through Unum. While no one expects a serious illness or accident to happen, if it does, it could keep you away from work for months or even years. Long-term disability insurance helps by replacing a portion of your income so you can continue to manage your household and focus on recovering. This plan will also pay you 60% of your base monthly salary up to $15,000 per month until Social Security normal retirement age, with a waiting period of 180 days of your disability. Hopefully during that time you do have short-term disability to be making those payments during that waiting period. However, you are able to get these two plans separate of one another. These benefits provide additional financial security, giving you peace of mind when the unexpected keeps you away from work. One of those benefits that you definitely don't want to have to use, but if you need it, you will be glad that it's there. We'll talk next steps and how to enroll. Your benefit administration tool for enrollment selections is going to be Workday. You can log into Workday using the organization ID Benchmark, and if you require any assistance, please stop by HR or email me at decastle@deloitte.com. When you log into Workday, you will see something similar to this that says Benefit Life Event or New Hire Benefit Event. You'll click into that in your inbox. Click Let's Get Started. On this screen, you will see tiles that show each of the available plans. For the plans that you're interested in enrolling in, you will hit Enroll. After that, you will see the plans available to you and hit Select on the plan you wish to select. Any of those blue hyperlinks you see will prompt additional information on the benefit. Next, you'll add your dependents. Your coverage level will automatically adjust based on who you include. After adding them, please make sure to check the box on their name before clicking Save. Don't forget, you'll need to add their date of birth and their Social Security number when you enroll. Once you have elected all of your benefits, you'll scroll down to hit Review and Sign. Here you will see a list of all of the benefits you have enrolled in, all of the benefits you have waived coverage in, and your weekly cost responsibility. Once you're satisfied with these elections, you will scroll down to the bottom and hit I accept on that legal notice and submit. You will know you are finished when you see this page that says Submitted. You've submitted your elections. If you have any questions, please feel free to reach out to me. I'd be more than happy to assist. You can reach out by stopping by the HR office or by emailing me with the email on the screen. However, if you'd like to discuss your benefits with a member of the corporate benefits team instead, you will not hurt my feelings, I promise. That is what they're there for. You can email benefitcenter@pyramidglobal.com or go to myworkday.com/benchmark. Thank you for your time today, and again, if you have any questions over any of the information reviewed, please feel free to reach out. Have a great day.